Thanks for sticking around. So we were originally in the story zone. My name's Maff again, and actually that was kind of appropriate. So even though we're here, we're gonna tell you a lot of what we do through stories, because that's what we do anyway. We gather stories. We find that it's a much richer source of data than numbers. We work with former journalists who specialise in finding stories in difficult environments, working all over the world, in getting people to self-report their stories. So we have tons of them, and we've animated a few. So I'm just going to show you a couple and tell you what on earth we're doing here at a health summit, and hopefully that'll be clear to you. Is it working, Gareth? Great, just leave it alone, mate.
Hi. I'm recently just come into the Camerados living room. Such a tranquil place. I recently lost my little boy due to cough death. Just started to breathe. This is such an amazing place for me to come and take my mind to another place. Whether I do it alone or I do it with a friend, a member of the public, you should always share your thoughts and what is going through your mind. Anybody with similar issues can call me anytime. Bye-bye.
I stayed in the TV quite late last night. I was just sat on the beanbag eating cake and feeling a little bit sorry for myself. And there was just me and a patient wearing a dressing gown and some slippers. Out of nowhere, a surgeon wearing his scrubs walked in and said, "I've never been in here before, but I need to. My brother's seriously ill and my sister's got severe mental health problems. And my mum died 4 weeks ago and I don't know where to go on my own." The patient that was sat there said, "You're not alone, you've got us, we've got each other." And then he got up and they hugged it out, and the surgeon came over to me and hugged me as well.
So those were two genuine stories from our public living rooms, particularly one which was in a teepee. Which was inside Blackpool Victoria Hospital. I don't know if any of you saw it. And our public living rooms, I'll come on to tell you a little bit more about them, are normally just exactly that. They look like a living room. They've got kind of sofas and chairs and fairy lights and a piano. And we've put them in all sorts of places over the last year. We've put them in a library, we've put them in a football stadium, we've put them in an art gallery, put them in a prison. There's one currently in Baltimore, we've done one on the Brooklyn Bridge. We've done them all over. But when we came to do one in a hospital, sofas and armchairs just didn't seem to quite stand out. So Sarah at the back there had this entirely sensible and obviously natural progression of an idea to have a giant Indian teepee. I mean, it's obvious, isn't it? But it was remarkable, the impact it had. But I'm going to stop there for a second, because, as I say, we were in the story zone. I actually thought of Jackanory. Do you remember Jackanory? It's very hip these days. People like Tom Hardy are doing it and everything, but in my day it wasn't like that. And it was all sort of cardigans and rocking chairs and what have you. So I want you to put you in that zone. This is the book I'm reading at bedtime. A mate of mine did a beautiful act of kindness and just said, "Maff, this seems to be all about Camerados. Every night I go to bed and I keep thinking, this is what Maff's doing." So he posted it to me, and so I'm just reading it. I was reading it in bed last night, and I thought, I think this is appropriate. So Jackanory, everybody. So this is by Atul Gawande, and it's called Being Mortal. And Atul Gawande, actually, let me just tell you who he is. So, as well as being an author, he's a surgeon in the Brigham and Women's Hospital in Boston, in America. And he's won various prizes. In his work in public health, he's the director of Ariadne Labs, which is a joint centre for health system innovation. That'll be appropriate for today. So this guy's a doctor, please remember that, okay? Because I'm not having a go at the health system, he is. Modern scientific capability has profoundly altered the course of human life. I need to sit down if it's checking away. There we go. Put my feet up. People live longer and better than at any other time in history, but scientific advances have turned the processes of aging and dying into medical experiences, matters to be managed by healthcare professionals, and we in the medical world have proved alarmingly unprepared for it. He goes on to say, there's no escaping the tragedy of life, which is what we are all aging, is that we are all aging from the day we are born. One may even come to understand and accept this fact. My dead and dying parents and patients don't haunt my dreams anymore. But that's not the same as saying one knows how to cope with what cannot be mended. I am in a profession that has succeeded because of its ability to fix. If your problem is fixable, we know just what to do. But if it's not, the fact that we have had no adequate answers to this question is troubling and has caused callousness, inhumanity, and extraordinary suffering. This experiment of making mortality a medical experience is just decades old. It is young, and the evidence is it is failing. So the contention I'm putting to you is that, much like your fantastic comment about mid-staffs, is there's an element to healthcare which is missing in an awful lot of hospitals, which is the non-medical stuff, because we're not just made up, we're not robots, we're not just made up of fixable medical problems. We're made up of these things called emotions and this thing called life, which, as Woody Allen said, from the moment you're born, the prognosis isn't great. So, being as we know that we're ultimately not fixable, beyond doing wonderful things to make us feel healthy during the period between birth and death, which the NHS, in my opinion, does better than any other healthcare system in the world, what about the other stuff that comes between those two rather important dates in our life? And Camerados, which is this movement that the Association of Camerados promotes, supports, and enables, is very much about that stuff. It's very much built on the fact that actually, to live a fulfilling life, all of us in this room actually only need two things: friends, purpose. Somebody in our life that matters to us and we matter to them, and something to get out of bed for in the morning. There really isn't a hell of a lot outside of that. We found this out from working for 20 years with people who have very, very tough lives. But to be honest, it applies to everybody. It absolutely applied to me. And I actually wasn't going to do this, but just because your story walloped me with a baseball bat at the back of the room when you started saying it, I just thought, I just hinted it for a second. But the way that I went from being mentally ill, self-harming and homeless to running the largest homeless provider in the country within 6 years was because I met somebody who turned my life around because they loved me, and because I started working for a homeless agency where I realised I could help other people who were worse off than me. Those two things actually happened in the same week, amazingly. I was playing piano on a cruise ship, my wife walked in, didn't know it was my wife then, proposed 6 weeks later, and Crisis, the homeless charity, offered me a job. Those two things happened in the same 7-day period. I hid from Crisis the fact that I had cuts all over my neck because I was taking scissors to myself. I didn't mention that in the interview. They got me the job. And listen to me, working with people who had very, very big problems and realising I could be useful to them, turned me around. And ran an event called the Crisis Open Christmas, which were shelters in London. And my pub story is that I turned the Millennium Dome into a homeless shelter one Christmas. Buy me a pint, I'll tell you about it, it's hilarious. So it worked for me as well. So it's a deeply personal story. So thank you for encouraging me to share that. But what's interesting is since the gang of us, and my colleagues at the back, started putting into action projects that encourage people to find friends and purpose, we started learning an awful lot. We have an approach at Camerados which is to embrace the mess and make stuff happen by Tuesday, rather than write a business plan for 9 months, do a feasibility study for 3 years, and then decide not to do it. So we just do it with a high threshold and understanding and tolerance for failure, which we do an awful lot. Failure is pretty essential. And so we've started lots of different projects. We did one called a Rapid Micro Business Program where we got people who were having a particularly tough time in their life and got them to trade with their own business within 4 weeks. That kind of was amazing, but it didn't quite work and wasn't quite sustainable. So we moved on to something else, and we moved on to public living rooms. The genesis of the idea for public living rooms actually stretches back to 2008, when I was running that provider I was telling you about, that Salvation Army homelessness service, which is the biggest service in the UK. It's about 1,000 staff, about 100 projects from Inverness to Penzance. And Sky News put a TV camera in my face in the East End and said, it's 2008, you're the biggest homeless provider, you've just, we've just seen the crash. A middle-class person has been found in a night shelter in London, which was all over the Observer that weekend, which is just a hysterical story. It's affecting the middle classes. It's always been affecting the middle classes, but anyway. What are you doing for people who are losing everything in the crash? And the truth is, I gave an incredibly rubbish answer. And I sat on the train home thinking, next time Sky News put the camera in front of me, have something decent to say. And I thought, what would that be? And of course, to my horror, I discovered that my answer was, if they could lose their house, that would be really helpful. Drug addiction, always good. Mental health, brilliant. Get a mental health problem. Beating up their partner, fantastic. Give me that. I've got loads for them. But to be honest, until you can give me that, I'm just going to hang about here waiting for them to fall down this crevasse and then meet me at the bottom with my ambulance. So I became obsessed by this idea of where do you go in times of a crisis? And actually, where do you go? And the two most common answers were the doctor, relevant to today, that people thought about healthcare, and Costa. Go to Costa or the pub with my mates. And so that's really revealing. Now we can't get away from the fact that the options were basically go and buy an overpriced blueberry muffin or go and access services. There were some people who don't have friends or the money to sit in Costa, and there's some people who don't particularly want to go to these scary environments. I mean, just have a think about the places in the world that if you're having a rubbish time that are offering you services. Don't get me wrong, full of wonderful people, but wipe clean, vinyl environments with hatches and risk assessments. That's exactly what I need today because I'm feeling really rough. I'll just go there then. No, I don't think so. And I don't want to go in Costa full of lots of smiling, happy people. And actually, maybe I don't want to see my friends, maybe I don't. I've had a lot of people recently who've said to me, Maff, I suddenly realised what public living rooms was about when I realised I didn't want to be with my friends. Or I didn't have any friends. So exactly what do you do? So we thought about this third space, a public living room. What if you create a place where you could just go, be, connect? So we started one in a funeral director's garage in Sheffield, ex-funeral director's garage, I have to say. The morgue became our kitchen. Don't ask. And we've since tried it in all the locations I told you, and we ended up in a TP in a hospital. But a couple of things that have happened which are really amazing, and I'm going to give the mic over in a second to some of the stories again, was that we discovered that the absolute best way to get friends and purpose is this vehicle called mutual aid. So in our innocence in the beginning, when we started, we thought, right, the friends bit is sitting over a cup of tea, and then the purpose bit is we'll have an arts and crafts corner. You know? actually the two things come together very powerfully when you look out for somebody. This is connected to a very powerful, we call it the secret sauce in Camerados, an incredibly powerful, counterintuitive thing that happens when you help someone. You really don't transform someone's life by helping them anywhere near as much as you transform them by asking them to help you. And forgive me, colleagues, because they're sick to death of me using this example, but it is extreme and it is still the best one I can think of. Is that many times I've been sat opposite someone who says the next thing they want to do in their life is kill themselves. I don't care how long you've worked in the sector, you never know what to say. The only thing that's ever worked for me is when I've asked them to do me a favour. Within half an hour, they're saying, honestly, Maff, calm down, stop being so anxious and stressed out, I'm all over it, I'm going to sort it for you. Look, I'll sort it, Maff, don't worry about it. They're not thinking about killing themselves. A woman came into our Blackpool living room when we were running it in the library. She had mascara down her face. She just refused to get in an ambulance and she was heading for North Pier to jump off. Came in the living room. In my previous life, we would have sat down, needs and risk assessment, head on one side, tell us all about the problems that are happening to you right now, boom, 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 boom. But at Camerados, we gave her a cup of tea, said, I'm sorry you're having a shit day, but actually, you know what, Colin in the corner's having a really shit day as well. The fellow on the mobility scooter, listen, do us a favour, could you sit down with Colin and have a chat with him? That's exactly what this woman, Sharon, did. Within half an hour, the two of them were laughing. By the end of the day, she had an apron on, she was running the living room and washing up the cups. Ask people to help you and see what happens. So this idea of mutual aid. The other thing that we found out is what Camerados means. And I think this really relates to hospitals and health because of the transitory nature of hospitals and how many thousands of people, 7,000 people pass through the atrium of Blackpool Victoria every hour, something ridiculous, it's crazy. And that is what we learned from a fellow called Wayne, he's from Blackpool, and he said to somebody within earshot of Sarah at the back, I'm not your friend, but I'm your Camerado, I've got your back, don't worry about it. And he walked off. And we became obsessed by what on earth is he talking about? What does this mean? So I said, Sarah, grab him, take him for a cuppa. Because Camerados for us had simply come from a poem by Walt Whitman. I'm a big fan of the TV. Ah, great, thank you. We'll come to it in a sec. Well, let's go through it now because you're all reading it anyway behind my back. Okay, would you mind reading that for me, sir?
I am a Muslim working in the hospital. I thought I'd spend my lunch break in the teepee. I had an interesting conversation with Sarah and a few others in the room. It is really good for people of other faiths to interact and remove stereotypes and stigma. The whole world just needs to understand each other and realise that not everyone is horrible. There are plenty of good people in the world, we just need to find them. Ashford.
Thanks very much, lovely. Can we have the next one, Gareth? Oh, wonderful. Could you read that one for me?
Wow is all I can say. I quite often feel lonely at work. The NHS is a lonely place. It's nice to know we are not alone and can support each other through the rough times in a place as cosy as this. Keep going, Camerados, you really are onto something.
Thank you very much. Would you mind, John?
First time in 2 weeks I've spoken to someone other than a medic. Thank you. Makes me feel there is some hope. The world could do with a little more love, spending, love spreading, a nice, calm, precious, is that precious? Peaceful place to sit for a while.
Thanks very much, John. Keep going, Gareth. Would someone over here help me out? Is that all right? Bless you.
A really good place to meet people and take your mind off everyday issues. My dad is undergoing treatment and it's somewhere to talk to new people and share experiences and get off the road and go somewhere different. Excellent place.
Relaxing after a busy shift, great space to either sit and chill or interact and chat with others. Great place to meet total strangers who become friends for a short space of time.
Thank you. It's worth saying at this point that we didn't give anybody any information particularly about what Camerados was about. Sarah just put a TP up and a blackboard which said, join the movement, be a Camerado, look out for each other. And we left a load of postcards out in a lovely little post box that Sarah had made and said, share your thoughts. So people kind of got there themselves.
What a lovely place. I spent over an hour relaxing in an armchair and talking to so many different people, including the hospital chaplain. I had bad news about my husband, so I was glad to have been here.
Sorry about the handwriting, it's not mine yet. Actually, what was interesting, we got quite a few shocking ones. There's one lady who said, I've just left my husband in the cardiac unit, I don't know if he's going to get through the night, but I came in here and I talked to a woman I never knew before and it just got me through the night. Now this one is a little bit too hard to read, but I just wanted to put it in there because I love it. It's kind of as messy as Camerados is as well, which I love. Put here, love it, great place to rest, chat and make contact. I visited it 5 times, each time spoken to different people. One visiting loved ones on the end of life pathway, one waiting for a bus, 4 teenagers chilling out, staff chatting, really enjoy it. The mix of people in there was really, really important to us as well, because actually if you think to yourself, and this is something we're really wanting to do with public living rooms, but it's something a hospital does naturally, is there's very, very few places in Britain where everybody from all walks of life all go in. You know, there were just certain kinds of people who don't go into an old bar one. I'm one of them. And there's some people who don't go into a good old-fashioned proper pub. Who are these people? There are some people who are Costa people, some are USA chicken pizza people. But everybody gets sick. Everybody goes to hospital. And one of the reasons we want to scale our idea within the NHS is because that democracy that happens of people from all backgrounds is amazing. There were kids from the neighbourhood who they didn't have anywhere to hang out in their neighbourhood near the hospital, so they came to the hospital to sit in the teepee, ended up talking to an old granddad, got on like a house on fire. Honestly, I mean, it's cliche Hollywood stuff, but it all happened. Would you mind trying to read this very difficult to read out postcard?
Admitted to A&E or attempted suicide. This was what needed. Cool lights too. What I needed, cool lights. Being lonely and lost. Then found camaraderie. Things can't thank me.
That was a tough gig I just gave you. Thanks a lot. And you're eating as well. Good. Lovely. Thank you, thank you, thank you. Shitty day today, but some lovely woman I'd never met before reminded me there is hope. I also have faith that this sort of stuff doesn't just happen in the north. Obviously, I'm slightly biased to think it might, but we will try TPs in the south. If anybody knows any southerners, that would be lovely. We can give that a go. I work many nights in the hospital. It can be very stressful and emotional at times. This TP has been my little haven for the past few shifts. Great idea. Every workplace should have one. Is that it? So, one of the things, I'm really pleased it finished on that one, because one of the things we were most surprised about, and we honestly didn't expect, was just how many staff would use it. We had doctors, nurses, surgeons. One I didn't put up there was a nurse who said, this place reminds me, maybe I should do a little bit more of a sitting on the end of the bed chatting thing. Another nurse said, and I've got a picture of her somewhere. Actually, I've got a picture of the TP on that original folder if you can find it. There was a lass who came in, who was a nurse, and she came in to do her knitting, and she said, my husband thinks if I come in the TP and do my knitting for an hour, I'm much nicer to be with by the time I get home. And she sat there and kept everybody company. And as you saw from the film, just the fact that a cancer surgeon walked in his regalia and asked for help, and a patient helped him, it does that other thing that we feel very strongly about, is it really changes the power dynamic. There were not many places in a hospital where a doctor, there you go, there's the TP. There were not many places in a hospital where a doctor and a patient could be on an equal footing as human beings. I mean, there isn't many. You know, the doctors have their staff room, and we have waiting rooms, or maybe the chapel. But we're trying to give somewhere where doctors and patients can actually interact. But it's not just about the TP, we're also going to be working in those waiting rooms, getting people talking. Chances are some of the waiting rooms, I mean, if you think about, you know, you're in the kidney clinic, everybody in that waiting room has similar renal problems. It'd be nice if they were talking to each other about it. Don't you think that would be a good thing? I don't think that's rocket science, but we'd really like to see that happening. And so, you know, from the wards to the canteen to the atrium with the TP, we want to be spreading this human connection and mutual aid. And we really want to be working with hospital volunteers. If any of you know hospital volunteers or hospitals that really want to improve their hospital volunteer experience, we are really eager to talk with them. I'm not going to bash you over the head with statistics about staff retention in the NHS. I'm not going to bash you over the head with statistics about patient experience, but I think you can probably guess that both of those things are a struggle in some hospitals, which are incredibly stressed and stretched. I mean, just the very nature of why you go to hospital suggests that this one building has an inordinate amount of stress inside it. People walking through that atrium who are going to say goodbye to a loved one for the last time, or a happy occasion but deeply stressful, childbirth, or hear some bad news. And that was said to me by the chief exec of Blackpool Victoria, and she was pointing at people walking past. She said, "You don't know what's going on in these people's lives and where they're going." So we think this is pretty important. So again, just a shout out to all of you that if you know any hospitals, please let us know. I think I'll probably stop there. I'm glad the postcards came up. I was really wanted to read those out. I just wondered if anybody had any questions. And I'm going to hope my colleagues help me out with the answers. You think it's a fantastic idea? Oh, cheers, John. Thank you, mate. Thank you.
I think one comment I'd like to make, which is sort of reoccurring from Lucy's to yours, which is actually going to come into mine, is something that we often talk about is actually going digital, you know, digital health, actually creating apps and stuff, when actually something that I think we all need to realise is to be careful with how much we actually do go digital. It's disconnecting us. You know, all the online platforms are disconnected, and what we're talking about is human connection with each other. That is what is changing people. When you actually talked about giving someone a purpose and saying, "Oh, go and help that person," that's what we need. Not go and look at this application. It's to be with each other, interact with each other, to be kind to each other. You're going to hear about what I want about in a second anyway, Christine, but I just wanted to say that. I think
no, thanks. I mean, it's really interesting. Although we use social media to tell people about the movement, we're very conscious that in many respects we're the anti-social media. We're slightly going against the tide, encouraging people to spend more time face to face. A very, very peculiar thing happens in our living rooms. The one that most astounds me is we have public living rooms in Sheffield, across the further education colleges. I say we have, they have, they're their public living rooms. And they're in campuses so these are massive campuses for kids 16 to 19 who are doing vocational studies. And I'd really expect them to just be like this. I don't know if any of you have teenage kids or no teenage kids, but this is a sort of pose that they often kind of... And I just expected the public living rooms to just be this. The amount of phone use that isn't happening in our public living rooms is extraordinary. It kind of blows my mind. I mean, of course, some bits and pieces are happening, but there's something about giving people permission, something about fairy lights and a piano and a sofa and look out for each other. They just kind of think, I'm not going to do that here. And, you know, permission is an amazing thing, giving people permission. We've learned loads of things doing this, and I have to tell you that we are rampant with mistakes and errors, and that's the mess that the path we've chosen to follow. If you want a perfectly executed strategic plan and processes, don't come work for us. But one of the things that we absolutely found out was that you don't have to tell people very much for them to feel they have permission to look out for someone else. It's inside us. What we're telling you is not rocket science. We didn't invent this. You know, all we're trying to do is reconnect people to it, which I think you're saying they haven't been entirely connected with. I do want to say at the end that if you're not a hospital, but you'd still like to have a public living room in your community. The way we're doing it is open sourcing it, and we can put you on a list, and you can, in time, receive one of our magical boxes. We have a public living room in a box. It literally is a magical box, and it will turn up in your house, and when it opens, a clock will be ticking, and in 3 months we will collect it from you. Not only to restock it, but we will collect it because you will have filled it with all of your stories, experiences and ideas from your public living room, and we will send it on to the next community who will open it, and there'll be a little letter from you and all of your wonderful experiences, and we are sending these around the world. There's a library in Michigan, there's a lovely fellow called Jeremy in Melbourne. There are people all over the world, but also all over the UK, who are asking us for these boxes. So if you want a box, let's get you on the list. Set up a public living room. It doesn't have to be onerous. It can be once a week, once a fortnight, once a month in your community, but somewhere that people can go and look out for each other. It really is delivered by the movement. We don't implement it. You do. So I think that's enough for me, so I can let the next fella come on. Thank you very much.